What if the signs of a heart attack were already happening in your everyday life, and you didn't even know it? Heart disease is the #1 killer in the world. And yet, most of its early symptoms are easy to miss. They don't always come with chest pain or a dramatic collapse. Instead, they sneak into your daily routine, disguised as fatigue, indigestion, or stress. In this video, we'll reveal 9 dangerous signs of heart disease that show up in your everyday habits: walking, eating, sleeping, even brushing your teeth. These subtle symptoms could be your body's cry for help. Watch until the end. Symptom number 7 is ignored by almost everyone, but doctors know it can mean serious trouble. Let's start protecting your heart right now. Subscribe and turn on the bell so you don't miss life-saving videos. The heart is your body's engine. It never stops working, even when you sleep. So when something goes wrong, the effects ripple through everything you do. That's why it's so important to recognize the hidden symptoms that show up in your regular routine. 1. Shortness of breath while doing simple tasks. Walking upstairs, carrying groceries, getting dressed. If you feel unusually breathless during small routine activities, your heart may not be pumping efficiently. This isn't the kind of breathlessness that comes from a workout. It's unexpected, and it happens even when you're not pushing yourself hard. It may feel like you can't get a full breath, or like you're winded after only mild exertion. Heart disease reduces oxygen supply throughout your body, especially during movement. If you've noticed you're breathing heavier than usual during normal chores, that's not just aging. It could be a blocked artery or weakening heart muscle. 2. Chest discomfort, even mild or unusual. Chest pain doesn't always come as a crushing feeling like in the movies. It might feel like pressure, squeezing, burning, tightness, or even like indigestion. Some people describe it as a heavy weight on the chest, or a fullness that won't go away. It can come and go, and sometimes it even spreads to the arms, neck, jaw, or back. What's dangerous is how often people ignore this symptom, thinking it's gas or anxiety. But even mild chest discomfort, especially if it's new or happens during activity, should be taken seriously. It could be your heart struggling to keep up with your body's needs. 3. Fatigue that hits you out of nowhere. We all feel tired sometimes. But the fatigue linked to heart disease is different. It's sudden, it's overwhelming, and it doesn't go away with rest. You might wake up tired or feel like taking a nap in the middle of the day, even if you had a full night's sleep. This type of fatigue can also come after light activity. What's happening? A weak or diseased heart can't pump enough blood to meet your body's energy demands. You run out of gas fast. If you're constantly exhausted for no clear reason, and it's affecting your ability to function, your heart could be struggling silently. 4. Swollen feet, ankles, or legs. Heart disease doesn't just affect the chest, it shows up in your legs too. If your feet, ankles, or legs are swelling more than usual, especially by the end of the day, your heart might not be pumping blood effectively. This causes fluid to back up in your lower body, a condition called edema. You might notice your socks leave deep marks on your legs, or your shoes feel tighter. It might even be hard to bend your ankles. If the swelling is persistent, painful, or paired with fatigue or breathlessness, don't ignore it. It could mean heart failure is developing. 5. Irregular heartbeat or palpitations. Ever feel like your heart is skipping beats, fluttering, or racing out of nowhere? Those strange rhythms are called palpitations. They can be harmless, caused by caffeine, dehydration, or stress. But they can also be a warning sign of arrhythmia or atrial fibrillation, which significantly increase your risk of stroke and heart failure. Many people ignore palpitations unless they're severe. But even occasional irregular beats, especially when paired with dizziness or shortness of breath, need to be checked. If your heart feels like it's flipping or pounding without a clear reason, schedule a heart evaluation immediately. 6. Persistent cough or wheezing, especially at night. A cough isn't always a lung problem. It can be a sign of heart failure. When your heart can't pump blood properly, fluid backs up into the lungs, causing congestion and coughing. You might notice a chronic dry cough that worsens when lying down or while sleeping. In some cases, the cough may bring up white or pink frothy mucus. Many people mistake this for allergies, asthma, or a cold. But if your cough persists, especially at night or when lying flat, and you feel tired or short of breath, it could mean your heart is under pressure. Don't ignore it. 7. Jaw, neck, shoulder, or arm pain, especially on the left side. One of the most dangerous heart disease symptoms doesn't start in the chest. It shows up in places you'd never expect. Jaw pain, shoulder aches, or a heavy feeling in your left arm can all be signs of a heart attack, especially in women. These symptoms often occur during physical exertion or stress, and they may disappear after rest, making them easy to ignore. If you feel tightness, dull aches, or pressure radiating from your chest to your upper body, treat it as an emergency. These are signs of a heart struggling to circulate blood, and that struggle could turn deadly fast. 8. Nausea, indigestion, or stomach pain. Believe it or not, your heart and stomach are closely connected. Some people experience nausea, heartburn, or abdominal pain during heart attacks, especially women. This is called referred pain. You might think it's just something you ate, but if indigestion hits suddenly during activity or comes with other symptoms like sweating, breathlessness, or lightheadedness, it could be a warning from your heart. This symptom is most often ignored because it feels so common. But in the context of heart disease, that stomach discomfort could be a silent alarm going off inside your chest. 9. Dizziness or lightheadedness during routine movement. Feeling dizzy after standing up, getting out of bed, or turning your head can be a sign that your blood pressure is unstable, possibly due to a weakened heart. The heart may not be pumping enough blood to your brain, especially during movement. This can make you feel faint, confused, or off balance. Dizziness caused by heart problems often appears suddenly and may be accompanied by chest discomfort or palpitations. If you find yourself grabbing onto walls or furniture to steady yourself, or you've had unexplained falls or near fainting spells, get your heart checked. It's your body begging you to listen. Heart disease is often silent until it isn't. And by the time most people take action, it's already too late. But your body is smarter than you think. It leaves clues, subtle signs that show up in your daily life, if you know how to spot them. Shortness of breath, fatigue, swelling, discomfort. All of these are ways your heart may be quietly failing you. But now you know better.